Glace Bay.
Thank you, Mr. Chair. So I don't know if the minister wants me to repeat that question, or just want to take it from where we left off would be fine.
Honourable Minister of Health.
Thank you very much, Mr. Chair. And again, I apologize for not having all our documentation with us because of the, I know that some printing happened relatively quick, and the department actually had not received the copy of supplementary detail. So we were lucky enough to have it, of course, in the library here. And we'll go forward from this one. So we're looking at page 13.3, which is, of course, DHA authority or District Health Authority spending. Acute care, addiction services, public health services, and mental health services. What that will include, as we see the increases, is of course the 7% non-wage issues of increases to the district health authorities. It includes funding to help settle the QP settlement in order to have the funding for that one. It does include the new programs that we're talking about, whether it be the oncology unit expansions or the satellite stuff that we're talking about in districts. You're talking about the safe needle legislation, so it does represent most of the new programs that are listed above in 13.2 and some of the other pages in supplementary detail.
Honourable Member for Glace Bay.
So just to further explain, those new funds are going to additional and expanded programs. Is that what you're saying? Not salaries, not.
Honourable Minister of Health.
Everything is included there. So, you know, the pension issue with QP, that's included there. The additional salaries are in that number as well. The new programs are in there. The 7% increase on non-wage items is in there. So all the current funding for DHAs plus the new funding for DHAs are included in the numbers we find on 13.3.
Honourable Member for Glace Bay.
Okay. Thank you, Mr. Chair. Mr. Minister, we see a decrease in funding in certain district health authorities for addiction services and mental health services. Why the decrease in those DHAs when overall spending is actually increasing?
Honourable Minister of Health.
Thank you very much, Mr. Chair, and Mr. Chair, to the member from Glace Bay, that would indicate the reallocations of funds of really tuning up on our programs to make sure that we have the correct expertise in different areas for them. So you'll see the programs being run. I know some addiction services stuff are run out of Kentville that serves, of course, all of Southwest, and those kinds of adjustments are happening, which is representative of the information that's before you.
Honourable Member for Glace Bay.
Just as Mr. Chair, as a reminder to the Minister that District Health Authority business plans were unacceptably late last year, and some DHAs didn't have their business plans approved until 9 months after the fiscal year began. And so a question to the Minister then, how can the DHA plan its year unless they have the approved business plans?
The Honourable Minister of Health.
Thank you very much, Mr. Chair, and Mr. Chair, the member opposite. Business planning for current year, so business planning for 2007, 2008 actually started process, I think, in November, getting the numbers ready, getting it ready for, of course, these days when we know exactly what the budget is. As soon as the budget is approved, the letters would go directly out to the district health authorities, giving them their final spending targets. There would be further discussions with the department and the district health authority on those final pieces. Last year, again, it did take a lot longer than anticipated. Of course, some of the district health authority did a wonderful job and had their business plans in, and we had them approved for quite some time. Other ones required some more mitigation and some more work with it. And you know, the example, of course, of District 1 would have received its final approval on its business plan for last year, probably sometimes last week. So, you know, the system itself is not perfect and is one that we want to continue to improve upon to make sure that all district health authorities have their budget approved early so that they can work and live to that budget that's set forward for them.
Honourable member for Glace Bay.
Thank you, Mr. Chair. I know the minister takes that subject very seriously, and is perhaps, I'm sure the department's a little bit perplexed about how to bring everything together, and I'm sure you're taking the process seriously. But I think at all levels to approve business plans early in the fiscal year is a goal that can be achieved, and I don't think that any later than 90 days perhaps is reasonable, or whatever the case may be. On page 13.4, under Executive Administration, all of the funding in that area is budgeted to be increased this year, despite the fact that all offices are forecasted to come in under budget for the 2006-2007 fiscal year. So why such a large increase in budget compared to the actuals and forecasts over the last 2 years?
The Honourable Minister of Health.
Thank you very much, Mr. Chair. Those numbers will be representative of new wage settlements for some of these employees. It would also be representative of the hiring of a number of other professionals. We are, in my estimation, in a lot of cases, understaffed in the Department of Health for the amount and volume of work that goes through that department. There are a number of positions, and the forecast estimate is representative of that, or forecast, what am I doing, estimate to estimate or forecast? Anyway, is representative of positions not being filled there during this current year, and basically not being able to recruit to some of those positions. So it is our hope over the next year is to get the department again up to full staffing levels, and of course we're including a Health Canada project that's in there, as well as covering those increases as per negotiated settlements.
Honourable member for Glace Bay.
Thank you, Mr. Chair. Mr. Minister, the increase, as I read it anyway, is over $6 million for the year compared to forecast from last fiscal year. So that additional money is going where this year?
The Honourable Minister of Health.
Thank you very much, Mr. Chair. And if we look from estimate to estimate of, I think it looks at 39 and some $million versus 42 and some $1 million, shows the increase that we did have a number of positions that were vacant, but also taking into consideration the cost of living increases and contract negotiations for those employees. So it is representative of pretty much those regular increases that we would receive year over year.
Honourable member for Glace Bay.
Thank you, Mr. Chair. Page 13.6, under other insured programs, assistance for low-income residents with diabetes. In the 2003 election, there was a promise to spend $3.2 million on that program. Budgeted $2.5 million for last year, but forecasted to come in at just over $1 million. So why the low uptake on that service, Mr. Minister?
Honourable Minister of Health.
Thank you very much, Mr. Chair, and that would be representative of the uptake of the program. The uptake of the program, I don't think, has been as good as we had envisioned. I know we probably have to do a little more work around making people aware of the program and, of course, how it works. Of course, the other issue that brings up over the next number of months is how that program works in parallel or as a part of the Nova Scotia Farmer Care Program, the Working Families Farmer Care Program, into the future. So again, it has been just probably the performance of the program hasn't been as good as we envisioned, and we will continue to promote it to help out all those low income residents with diabetes.
Honourable member for Glace Bay.
Thank you, Mr. Chair. Well, the minister outlined the purpose of the program, but I'm wondering, is the minister saying that it wasn't perhaps properly communicated to healthcare providers or to the general public? Because the actual for 05-06 was even lower. The budget was $1.5 million, but again, only $144,000 was actually spent. And why would that happen? So, is the program working? And if not, why not? Or could the money be better spent or budgeted for a different program? Or is it a question of, is it simply a question of poor communications for that program?
The Honourable Minister of Health.
Thank you very much, Mr. Chair, and to the member opposite. I will I'll pick a few of those questions out of there and try to answer them as best I can. As we found out with a lot of programs, that the uptake itself takes probably 3 years in order to become fully subscribed to a program. So, of course, in a best world, if everybody had subscribed to it immediately, we would probably see a program that would be in that $3 million range. What we know today is that we're looking at about a subscription rate of about 33% of the population that is eligible for the program. We are still looking at an increase of about $625,000 for that program. You know, I think we've done a relative good job of advertising it, but we have not got to everybody yet. And I think what we want to do is continue to promote it with of course physicians, with communities and those types of things, to make people aware that there is a low-income diabetes assistance program.
The Honourable Member for Glace Bay.
Thank you, Mr. Chair. We're still on the same page. Under prosthetic services payments, there's a decrease there, Mr. Minister. Why?
Honourable Minister of Health.
Thank you very much. I guess I could have answered this one quite quickly. On prosthetic service payments, it is a utilization-driven program, and the requirement for prostheses in the province has diminished. So, you know, we're looking at a program that's, of course, representative to the demand for that service. So, of course, the demand has not required it to expend that much money on prosthetic services.
Honourable Member for Glace Bay.
Thank you, Mr. Chair. Same question, Mr. Minister, under the next category, sign language interpreter, decreased as well. Why?
Honourable Minister of Health.
Again, it's representative of utilization, looking at its requirement over the last number of years. We feel that the $126,000 is representative of the requirement for it across our system, and I believe that's the program that helps and provide to our hearing impaired folks within our hospital system.
Honourable Member for Glace Bay.
Thank you, Mr. Chair. Mr. Minister, we're still on the same page, but just for general information, special consideration, special drug programs, special dental plans, special programs. What programs fall under those budget items?
The Honourable Minister of Health.
Thank you very much, Mr. Chair, and I'm hoping that this is the information that's required. You know, we need to look, and I just want to make sure that we're not doubling up on some of these programs. We have the cystic fibrosis program, diabetes insipidus program, growth hormone program, cancer drug program, DEANS, and I don't know what that acronym stands for. The diabetes system, we've already talked about that one. The children's dental program, which I believe, okay, that's by itself. IWK block funding, dental surgical, orthometric payments, prosthetic service payments, I guess it was already there. Sign language is there. Special consideration. Still need to get probably further information on that one. I'll try to have that for you tomorrow. A special dental cleft palate, a special dental mentally challenged, maxillofacial prosthodontics, and a few other insured programs. So what I'll do is I'll try to get, as best I can, a listing of those special programs for you tomorrow.
Honourable Member for Glace Bay.
Thank you, Mr. Chair. There was 32 million under special drug programs. Is that the catastrophic drug fund, or and if not, where are those? Where is that money going?
Honourable Minister of Health.
Thank you very much, Mr. Chair. And that special drug programs are sort of the exception drug programs. Cystic fibrosis, the diabetes insipidus, growth hormone, the cancer assistance program for those individuals. I think it's the under $15,000 of income. Diabetes assistance program, which shows there. Just wondering why it's showing twice there. Assistance for diabetes or diabetes assistance program. I don't know if those are the same ones. Oh, previously existing ones. So there were some people on a previous existing program, and exemption drugs. And I probably would also guess that some of the funding there for Fabry's disease is there, and a couple of those difficult one-off kinds of drugs that we provide to the citizens of Nova Scotia.
Honourable Member for Glace Bay.
Thank you, Mr. Chair. I'm sure the minister knows, because we referred to this yesterday as well, and others have asked questions about it. But we know that the cost of medication is, to say the least, getting out of hand in this province and elsewhere. And this province has one of the worst records for the number of approved drugs that aren't covered under our insurance, under insured plans. And we've heard the stories about Avastin and so on that are not covered, and people losing their homes or their life savings and families, and the costs associated with those, literally with our life-saving drugs, and also the cost of lives that are lost because people simply don't have the ability to continue to pay for them. It's a troubling area of health care, and one that I know won't, it's going to be around for some time. It's not going to go anywhere. It's only going to get worse. That's just not a comment, Mr. Chair. It's not a question for the minister. On page 13.7, under Emergency Health Services, under the title of Communications and Dispatch, there's an increase there of $1.2 million since last year's budget. So why the large increase?
The Honourable Minister of Health.
Thank you very much, Mr. Chair. And I think last year what we had is a one-time payment that we provided through to EMC or to the dispatch center for some operations, some system upgrade. And basically what you see today is that that increase that was actually there last year has now been provided into the base funding of the Communications Dispatch Center for EHS.
Honourable Member for Glace Bay.
So that was, I take it that's technological, whatever the case may be, so that it would continue to be the best service that you could possibly offer in terms of EHS. I sound like I'm speaking on behalf of the minister. I'm not. I'm just assuming that. But assuming that the minister and the department have done the right thing there, then they would have the most up-to-date equipment that they could possibly get their hands on. Under the next category, under provincial programs, the total is $9.6 million being spent in that area. And just if we could, Mr. Minister, some detail on exactly what that is and what it's being spent on.
Honorable Minister of Health.
Thank you very much. As Alan tries to find some further details on it, what I understand is that a lot of those are contractual obligations that we have to continue to fund, whether they be wage settlement or what have you on that one. And we're still trying to find some further detail on that. Maybe what I'll do is I'll come back with some further detail on that one subsequently after.
Honorable Member for Glace Bay.
Thank you, Mr. Chair. That's fine. Just that's what we're looking for, is some detail. And I'm wondering if it's been thought about that the pending contract negotiations with the paramedics, is that being taken into consideration? We know, and we've heard from paramedics across the province, they're among the worst paid in the country, but we have one of the best ambulance services in the world, and we've received accolades from not only from other provinces, but from other countries on our air ambulance service and the quality of our paramedics and so on. So I'm wondering if the minister would answer the question, that is the government prepared to, go to the bargaining table with the paramedics? Has money been set aside to address the salary concerns of the paramedics in this province?
Honorable Minister of Health.
Mr. Chair, and just to the previous program, the previous question on provincial program under the EHS line, the provincial program would underline the air ambulance system. So the air ambulance system, the difference between forecast and estimate would mean the difference in funding and those types of things as per wage adjustments in contracts. The issue of the paramedic wage settlement, of course, the contract does not come due until March 31st, 2008. So there is a full year right now within this remaining within this contract. And of course, we would support a normal bargaining process where the two parties would have the opportunity to sit and discuss the situation and hopefully come up with a mutually beneficial agreement. But for the purposes of this year's budget, of course, we can only account for the amount of funding that we would anticipate to have to come up with in this fiscal year only. So the number would not be representative of the paramedic contract. Again, the paramedic contract is one that does concern me a little to hear the displeasure with the current agreement, but it was one in our estimation that was negotiated fairly, and one that did provide a fair increase to those professionals. And we would hope that future negotiations through the bargaining process would benefit them as well as it has across our system today.
Honourable Member for Glace Bay.
I'm sure. Thank you, Mr. Chair. I'm sure the minister can see the irony, I guess, is the best word I can find. You have the lowest paid paramedics in the country, but you have the best ambulance service, the best care that we can give in an ambulance service throughout not only the country, but one of the best ambulance services in the world. So I'm sure that we're all hoping that negotiations will prove to be fruitful and work out, and that both sides can iron out all of their differences before it gets to the point where we wouldn't even want to contemplate what would happen if it didn't work out anyway. On the next page, 13.8, under other healthcare initiatives, under the topic of dialysis, the provincial program budget for dialysis has been cut almost in half. So perhaps the minister could explain why.
The Honourable Minister of Health.
Development. Yeah, okay. Thank you very much, Mr. Chair. And again, I'm just going to apologize for maybe getting further information from my officials to make sure I have the correct answers for all of these. When it comes to the provincial dialysis program, there had been a fair amount of work done over the last couple of years in the development of what that provincial program would look like. The number you see today is representative of what implementation of that program would be. The actual funding, I believe, a lot of the funding will be found over with the Capital Health Authority budget, who will be the managers of that provincial program. So the 800,000 is representative of the administrative costs and setup costs and continuation of that provincial program, while the actual dialysis costs, nursing costs, and those kinds of things are held within the QE2 budget, or within the Capital Health budget.
Honourable Member for Glace Bay.
Thank you, Mr. Minister, for that explanation. You'll also see information, same page, information products development. The budget the same as last year. However, the forecast for 06-07 is coming in at less than half that was actually spent. Why is that?
Honourable Minister of Health.
Thank you very much, Mr. Chair. That line item, information products development, would indicate the development of the web services around, I believe, the wait time issues. What we found is we were unable to implement everything that we could in the last fiscal year. So it would show that we spent a little less money than we had anticipated, but we know that there's still a fair amount of work to be done in this current year. So that funding will remain at that 355. We'll try that, 355,500.
Honourable Member for Glace Bay.
The under mental health programs, Mr. Minister, it shows it's cut by more than half. Again, an explanation of that, please.
The Honourable Minister of Health.
Thank you very much, Mr. Chair, and that would underline a reallocation of funding from the direct provincial program to the district health authorities who actually administer and operate those programs.
Honourable Member for Glace Bay.
And below that, primary care programs. Again, the same situation, same answer.
Honourable Minister of Health.
Thank you very much, Mr. Chair. And yeah, that would be the same answer where, you know, as we continue to evolve through primary health care and some of these other provincial programs, you know, we do start to flow the money to the district health authorities who actually administer those programs.
Honourable Member for Glace Bay.
I just have a couple more questions for the Minister, and I will indicate to the Chair, please, that I will be sharing my time with my colleague from King's West in just a moment or so. I just wanted to touch again on on 13.9, Mr. Minister, on the Working Families Pharmacare program, which is a new program, but $5 million towards a functioning pharmacare program just doesn't seem to be enough. It's not close to what was actually promised. So, I'm, you know, under that situation, I'm wondering if the Minister is confident that that indeed that program is going to be of some use with that little amount of money being spent towards it. Not that $5 million is a small amount of money, but it's much less than what was promised.
Honourable Minister of Health.
Thank you very much, Mr. Chair. Mr. Chair, of course, the funding that we see today for the Working Families Pharmacare program, Nova Scotia Pharmacare program, is representative of the setup administration costs, the computer system that we required in order to take in the premiums or the co-pays and monitor those issues, and also the hiring of professionals in order to administer the program. It is still my estimation and my want to have this program up and running, hopefully by March of 2008. I know that the Division of Farmer Care is sort of pleading with us to give them the time to set it up correctly. And the issue that we have right now is that we're still working on a couple of models of what this Farmer Care program will look like in the end. And the estimation in our first year of full operation will probably cost us somewhere in the range of $30 to $40 million, fully subscribed. And again, this depends on the model. Would range anywhere between, I believe, 60 and 75, $80 million once it is fully subscribed and kicking out the benefits to Nova Scotians. So it is a sizable program, but it does require a fair amount of lead time in order to make sure that we set up the systems that are required to administer a reasonable farmer care program for all Nova Scotians.
Honourable member for Glace Bay.
Thank you, Mr. Chair, and as I indicated, I'll be sharing the remainder of my time, which I think is approximately 20 minutes, with my colleague from Kings West.
Honourable member for Kings West.
Thank you, Mr. Chair, and certainly pleased to have the opportunity to ask a few questions, make a few comments during this segment of the estimates on the health budget. And certainly welcome the members present from the staff. And so with that, certainly recently I joined the minister in the official opening of the MRI at Valley Regional Hospital, and certainly felt that was a great step forward in providing the services that we've all come to expect from a regional hospital. And certainly we are all hoping that within time that it will reduce the wait times for MRIs. But certainly on that occasion we were made very, very much aware of how valuable that piece of equipment, that diagnostic equipment, has been. And also in the budget, I was certainly more than pleased to see that funding is going to be in place for an oncologist. And I had asked about 3 years ago that question and followed it up in other estimates on the budget, talking about the toll that travel does impact on people who are sick and in the process of treatment. So along that theme, there still is one area that I don't think has the medical complications associated with it that require a need for patients to be going to Halifax for treatment. And that's in the area of certain dialysis. And currently there are patients that cannot get the service in Berwick, where there is a dialysis site, and so we have patients that move from the valley to Halifax. And so I was just wanting to get some background in terms of what a long-range plan may be in the region to be able to look after dialysis on 100% of the cases 100% of the time. Again, and this one, sometimes unlike a cancer treatment, which may be once a week, dialysis patients will go to Halifax 3 days a week. And so it is a huge toll on the patient and on the family. So I was just wondering where this area may be going.
Honourable Minister of Health.
Thank you very much, Mr. Chair. And before I get to answering the question, I do want to make maybe two comments around the issues that were brought forward by the member for Kings West. First of all, the first comment is that Alan here, who is my CFO, had the opportunity to come from Berwick to go through the wonderful institution of Kings West High School, where I know that the member opposite was a teacher. I know he didn't have the opportunity to teach Alan but I know he was they did share some hall space on a couple of occasions. So I think some of that, maybe that good Berwick common sense has rubbed off on my CFO. The issue of the expansion of MRIs is one that I wish I could take full credit for, but I did. It was an initiative started by some previous ministers, and I want to thank them for the negotiations that they would have had with the federal government on the expansion of MRIs in the province. And as we look at that, we do have now more MRIs, or we'll have, once they're all fully operational, is more MRIs per population than any province in Canada. So, and I think that is a testament to their work and the work of the district health authorities in making us understand the importance of that very important diagnostic tool. And I think the announcement that we had the other day, of course, my colleague from Kings West was there, my colleague from Kings South and Kings North, really celebrating having that type of infrastructure at the regional hospital in Kentville. And really to underline the importance of it, really during our visit there, of course, the MRI was seeing patients, and what we did find out throughout that day, we did not have our opportunity to really go into the machine or see the machine directly, because it was seeing the patient, and because I think of that machine is that they were able to find some pathology with that patient and able to provide more care for her through her illness, whatever that illness was. And it's just a testament to having that piece of equipment that resident was able to get the service there in Kentville, and to get that follow-up almost immediately after finding that type of pathology or that whatever they found. The area around dialysis is one that we have been working towards, and the member for Glace Bay brought up the budget line for the provincial program of dialysis. And as we know, we provide dialysis, hemodialysis in many different areas around the province. Cape Breton District Health Authority, the Southwest District Health Authority, who do manage their own programs. Then the Capital District Health Authority and IWK Centre operate in-center hemodialysis programs in Nova Scotia, and operate about 10 satellite sites, and one of them being the one in Berwick. So even though it's within the Valley Regional or District Health Authority, it's the dialysis site is actually being managed by the Capital Health Dialysis Group. And what we're trying to do is continue to develop what that provincial program is looking like, to look at where our populations of people requiring dialysis are going to be in the future, and to make sure we make those adjustments as we go along. We're also looking at new models of care. If we look at what's happening at St. Martha's in Antigonish, there has a brand new facility open up there again in conjunction with Capital Health and the dialysis group there. And I know that the member for Antigonish worked long and hard during his tenure as Minister of Health as well, to make sure that was there for the patients and residents of his community. But what we're also doing there is looking at the model of care of how it works, using some other nursing staff in manning I guess manning is the right word, that facility, making sure that they're receiving quality care at that site. So there are a number of things going on in dialysis, and I know there is a review and some thought going into the site in Berwick to make sure that that's the correct site for dialysis, or maybe it should be moving to another site to better respond to the majority of the population that requires hemodialysis at this point.
The honourable member for Kings West.
Thank you very much, Minister, for that overview of where things are. I just will follow up with a very quick ask here, and that is there some timeline being placed, at least on the review process, leading up to, of course, a decision on this, and will it, and perhaps more than anything, will it offer that full range of services? I know that there is a certain type of dialysis, and you'll have to provide me, maybe, Deputy, with what exactly the name of that dialysis patients must come to the city for. So is there a timeline on the review? And is it possible that a different site or an enhanced site in Berwick will offer the full range of services?
Honorable Minister of Health.
Okay, thank you very much, Mr. Chair. And, you know, I think a couple of the issues, especially with the renal dialysis unit in Berwick, I think the issue is really from the recommendations that are coming forward to us that they are requesting to have certain infrastructures in place around it, which would include, you know, a regional hospital site. So there is a couple of issues around what's going to constitute safe renal dialysis, what kind of other services are going to be there, what kind of quarantine capabilities are available, and I'm just sort of trying to guess of why some of your residents would be coming to Halifax for their service or for their dialysis, but it would probably be because of certain diseases or blood diseases that might be in their systems that they require quarantine during that dialysis that might not be offered at the Berwick site today. The other thing that we're trying to do as a provincial program, and especially through our continuing care strategy, is trying to provide more peritoneal dialysis, which is more of a home type process where a lot of people can get along quite well at home with a little bit of help from VON or from some nursing staff. So there are a number of things going on, and the provincial strategy itself, I'm not too sure on what the deadline is and when we expect to have that program available, but what I'll do is I'll try to communicate to you before the end of estimates.
Honorable Member for Kings West.
Thank you, Mr. Chair, and thank you, Mr. Minister, for that perspective. One of the areas that, as well, has been pretty much a success story in the District Health Authority in the Annapolis Valley is certainly around the collaborative practice in Annapolis Royal, and now, of course, they are looking at a site in Middleton. I guess I would say that if we're out in the media with it, it's pretty well, I guess, having been given the blessing to go forward, and with 2 doctors, but certainly more personnel perhaps required there, especially around medical staff, and with the retirement of 2 doctors, you know, what one time was probably not a big story, and you just wish the doctor, you know, the best in retirement, or if he had scaled his practice down to, you know, a few nursing home visits or things like that, you wished him well as he changed direction. But today, when a doctor leaves a community, and a small rural community, it is big news. There's probably 2,000 to 3,000 patients that are without a family doctor. So recruitment for the Middleton area, with 2 doctors retiring in June, and another, you know, certainly at least 4 or 5 doctors who are 60 years of age. You know, we are, the concern is mounting. I know there's a team in place to do some investigation, but I'm wondering if the minister could update how things are going in that very critical area. We all know the importance of a GP.
Honorable Minister of Health.
Thank you very much, Mr. Chair, and to the member of Kings West. In the issue of Middleton, I think the issue that we're trying to pull off there is, of course, making sure that service still continues as best it can from the Middleton site. I know the district is working right now with area physicians to look at another form of remuneration so that we might be able to get some more service out of the existing physicians. I know there's a recruitment campaign on right now looking at replacing a couple of physicians in that area as well. But the other issue I think that I think is probably really good for the Middleton area as well is that as we look at alternate service delivery, as we're looking at community healthcare clinics, community healthcare centers, population health pieces, you know, we're not just looking at maintaining ERs, we're looking at making the population healthier. And I think that's a valued piece. So not only will there be a doctor waiting for an emergency to show up, you'll have some doctors with maybe some nurse practitioners, with some other healthcare professionals working towards keeping the community healthier. So not only would you come in with emergency, but you would come in for some basic health advice, some basic health referral, and those kinds of things. And in communities where this has been used, and in other areas in Canada and in North America and really in Europe, you know, there has been some tremendous success with it, even to the point where, you know, they wouldn't want to go back to the old model if they could. So, you know, there's a number of things that are going on that really bode well for the Middleton site.
Honourable member for Kings West.
Thank you, Mr. Minister. I do, however, want to press a little bit further there, just to I guess, find out whether or not there are at least you know, some doctors who are taking a look at the area, and that may possibly be in place by as early as June or July to pick up once we lose a couple of doctors. So I'm just wondering, you know, how recruitment is going generally in the province this year, and in particular for the Valley area.
The Honourable Minister of Health.
Thank you very much, Mr. Chair. And as we would be trying to identify areas where we need a little more work done, make sure that we're focusing in to make sure that there's physicians come to the area. Of course, Middleton is one of those areas that's been identified, so our provincial recruiter, Frank Peters, would be available to, or is available to the District Health Authority to continue to help them in finding physicians for that area. I would probably have to get you further details on really how they're doing. I don't know if they have identified a couple of people that might be interested in the area or what have you. So I would endeavor to maybe get you some further information on the recruitment process and how it's going for the Middleton site.
The honourable member for Kings West.
Thank you, Mr. Chair, and through to the minister. One of the I guess personal experiences of the past year was to have to use the emergency ward in Valley Regional prior to hospitalization, and certainly on all occasions there it is truly an experience. And I know they have tried to reduce the number of patients and get rid of the overflow. I'm just wondering what's the progress report on the emergency ward makeover. Certainly in having taken a look at the plans, having been in the hospital, and having the communications director, Jan McKinnon, and Dr. Harrigan give me an overview there. I'm just wondering about what is the timeline, what is the plan when we can see the emergency ward take on a whole new look.
The Honourable Minister of Health.
Thank you very much, Mr. Chair, and I don't have necessarily all the details on the Valley Regional Hospital or redevelopment plan. I know that there has been a fair amount of work ongoing in those areas where there hasn't been too much patient flow. I think the next step really is they're moving a certain bunch of I don't know if it's diagnostics or administration. They're moving it into one area. There's sort of a living plan of where people are going in the interim as places are redeveloped into inpatient beds and or diagnostic areas. But I would again and maybe endeavor to provide further information to the member from Kings West on the renovations at Valley Regional.
The Honourable member for Kings West.
Thank you. I'm not sure how much time I have left here. Maybe
About 8 minutes.
About 8 minutes. Okay. Probably we'll get another opportunity later to continue with some questions. But just in case, we've got a lineup here of colleagues to ask a question. Recently, I had a call and a conversation with one of the doctors who practices at the Valley Regional, and I'm wondering if there is a provincial policy, or is it a DHA policy, or was it just the state of the demand and the pressure on the beds, as we know, at Valley Regional. But the doctor was certainly, in a state of awe that he was called at midnight to give discharge orders to take a patient, a 91-year-old patient, at the Valley Regional out to Soldiers Memorial. And I'm just wondering if there is some policy pieces that when you get somebody at that age and probably in that, frailty, to have to endure this, plus get the doctor to come from a neighboring community to discharge such a patient. And it was just something that caught my attention that I thought I should ask whether it was just one of those, kind of immediacies, or whether there is some policy to perhaps try to prevent that kind of movement.
The Honourable Minister of Health.
Thank you very much, Mr. Chair, and to the member from Kings West, I thank him for that question as well. And that one really revolves around, I think, a policy of the District Health Authority, and what I would probably guess as well, and I really shouldn't be guessing, but I will in this case, and speculate, is that there was probably an impending code purple at that facility, and they were looking for ways to free up some beds in case of emergency and those types of things. And from time to time, not a regular occurrence, would they be looking at those patients that could receive that alternate level of service. And I don't know what the situation would be with this patient, but I probably would guess that they were trying to free up some space within that hospital in case of emergency to make sure that they would not be hitting that code purple. I would question the time of night on calling a physician in to do the discharge, but ultimately I would guess it would have to revolve around the issue of code purple that we've been having at Valley Regional and other sites around the province.
The Honourable Member for Kings West.
Just a short time left, so I'll probably just end here, maybe start here if I get another opportunity. Certainly the role, the position of the nurse practitioner has, been given a lot of talk and a lot of attention over the past while, and there's no question about the value of that specialty area of nursing and where they can fit into the delivery of I guess, a range of services and in different communities and different health settings. And I'm just wondering, for the continued development of the nurse practitioner position, and especially probably along the lines of emergency departments, clinics, also rural and remote areas. I'm just wondering if there's a master plan from the Department of Health that sees the progression and the movement towards more nurse practitioners in the province.
The Honourable Minister of Health.
Thank you very much, Mr. Chair. And Mr. Chair, just to close in on this one, nurse practitioners, we feel, are a very important addition to the Nova Scotia healthcare system, which is why, again, this year we have increased the number of physicians from 19 to 25. We're focusing in on some primary healthcare clinics. Queens, South Queens, which is an investment of about $225,000, as well as Inverness, which is looking at an increase of $150,000. If you look at the added work, we were including in the budget this year of $1.2 million for nurse practitioners. DHA 3 is seeing an increase in their budget for nurse practitioners of $180,000. So, as the DHAs develop and bring their budget plans to us of the services that they want to provide, which would include the usage of nurse practitioners in different settings, we would fund those accordingly. The thing that we want to continue to do with nurse practitioners, though, is really use them where they're working in communities, so community health, primary health care, rather than working in emergency rooms and more critical care settings. Because, and I know from your seat, mate, the member for Digby Annapolis is a real advocate of that community involvement that nurse practitioners have been exhibiting across the province. The other place that we would really like to work with nurse practitioners is in the long-term care setting. We have a pilot project, of course, at Northwood, where we're utilizing the nurse practitioner to see those patients, to work on their wellness. And what we're seeing is there's a lot less voyages to emergency rooms, or a lot less visits to the emergency room from the Northwood site on North Street to the ER at the infirmary site. So, you know, they know the health of those individuals, they know the indicators, and they're keeping those individuals a lot less healthier, and then keeping them out of the acute care system where, you know, we know the pressures that we have there. So it will continue to focus in on nurse practitioners, and hopefully the next few budgets will show fair increases in that realm as well. So I thank the member for Kings West for his questions.
Chair now recognizes the honourable member for Sackville-Cobequid. The honourable member for Sackville-Cobequid.
Sorry, I thought I had a minute there, sir. Thank you. I appreciate the acknowledgement. What I'm going to do, actually, I'm only going to use probably half of my hour and then share my time with my colleague from Queens. What I'd like to do is maybe ask a question on pharmacare, which I forgot earlier, and then go on to long-term care stuff, which I know the minister will be quite interested in. One of the things that we've heard quite often, we brought it up in this chamber, is around drug coverage, and I think there definitely is a gap, a huge gap, which I feel, in the services between Department of Health and that of Department of Community Services, especially around the cutoffs for programs for drugs, especially the drug assistance for cancer program. And that cutoff, I know there's an acronym for it, but the cutoff for that is $15,720 currently. And I've met, actually, you know, in my time off, Mr. Chairman, I just met with the Canadian Cancer Society, and we're talking different issues, and I had indicated that I was going to bring this up with the minister. And so my question is, when is government going to look at increasing the allowance or the cutoff for the cancer patients through the drug assistance program that they deliver?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And really, what we're trying to accomplish through the modeling for through the provincial pharmacare program is to look at some of the other programs that we have available today. And one of them would include the low-income cancer program, and I forget the exact name for it. But we would look at rolling some of those programs, including this one, into the main pharmacare program. So those folks would be able to receive of the help that they have today, plus maybe even a little more.
The honourable member for Sackville-Cobequid.
But we know, Mr. Chairman, that program is well off more than a year now. It'll be over a year before that program is up and running, hopefully fully. But it's interesting because, you know, when you talk about the Canadian Cancer Society and them being involved in this program, that, you know, years ago, I believe the cutoff for any drug-assisted program was around $12,000. And, you know, the Cancer Society at the time, and it was years ago, prior to this government, had indicated to government that they don't want it anymore. You know, government take back delivery of that program because, you know, they're tired as an advocacy group for cancer of declining Nova Scotians the ability to gain access to drugs. And I think at that time there was an agreement that, well, we'll increase it, we'll raise that limit, and that's how we came to the 15,720, I believe. So it's important that we recognize that, you know, within the next year, there's an area. It's not as broad with the number of individuals that would take advantage of it compared to a family, low income, whatever the terminology, the family working pharmacare program will take. So are you going to wait, or does the Cancer Society have to wait until the implementation of the Families Farmer Care program that you're going to introduce before you increase that?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And one of the directives as we've gotten, as we work on the development of the Farmer Care program, is to look at the existing farmer care programs that we have in the province and see how they could work within a new farmer care program, and which is exactly what we're doing with this one. Mr. Chair, I think there continues to be a little bit of misunderstanding from the member for Sackville-Cobequid on the timing and the setup of the farmer care program. And as I've said before, it's going to take us about 10 months to set up the program, to make it, to advertise it, and have people benefiting from it in March of 2008, which I think is a extremely fast turnaround for a program of its size. But Mr. Chair, I think to the crux of the issue is that we will be looking to see how we can roll these programs, which I feel is you know, it does not address the needs of Nova Scotians, and roll it into a program that truly does.
The Honourable Member for Sackville-Cobequid.
So I'd like to go now to a quick line in the estimates, and it's page 13.8 for the minister, and it's and I talked a little bit about diabetes and those initiatives that, you know, and the groups that support initiatives like Diabetes and Stroke Foundation, and in there it's under the dialysis in the provincial program. So again, it's 13.8 of the details. Yeah, supplementary details. Sorry. And the line item was last year had an estimate of 1.5 million and had a forecast of 1.44 million, and this year it's at $800,000. So I understand that it would be a decrease of about $640,000. So I'm just wondering if the minister could inform me of why such a dramatic decrease on that line item for dialysis in the provincial program.
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And what that program is indicative of, and especially the funding that we do find there, is that the 1.5 or the actual forecast of $1.4 million is the setup of a provincial program, consulting work that's been done, those kinds of things. And what we're moving on to now is the hiring of an individual that will be responsible for the provincial diabetic or the provincial dialysis program. But the actual programming is funded through the district health authorities. So you'll see, so it doesn't, the 800,000 that's showing here is only indicative of the administration costs of that provincial program, now that the development has been pretty much completed for that program.
The Honourable Member for Sackville-Cobequid.
Okay, thank you for that clarification. I mean, there's so many line items, you never know where the money's going. So when you see a reduction like that, it begs the question. So now I'd like to talk around the issue of the long-term care. Of course, that has been a main topic, I think, in this province for several years, definitely with our caucus. And I know in the recent election that, you know, long-term care and home care is an important issue here in the province, and one that residents expect government to implement changes and increase the number of long-term care beds, transitional care beds, increase home support systems. So with the strategic framework that the government, or their plan, that they have unveiled to the province, in that announcement, I believe it was, it might have been earlier this year or at the end of last year in Truro, that there was going to be a creation of 150 more additional transitional care beds. So I just wondered if the minister could enlighten me, and I can't remember if I got this information, on where those transitional care beds will be throughout the province.
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And Mr. Chair, I'm glad the member from Sackville-Cobequid has brought this issue forward, because I think there's probably no one issue in my mind that's more important than addressing the long-term care issue in this province. If you look at what the effects of not having enough beds across the system are available for our seniors, has impacted the operations of the acute care system for some time now. And it's really turning into a bit of a crisis where a lot of hospitals now, because of not being able to utilize beds the way they want to, we're seeing some hospitals actually have utilizations of somewhere near 104 to 106%, where probably an efficient hospital should be working at somewhere near 92 or 93%. So there's actually some room to react to different situations. The transitional unit piece that we've talked about, which is about 150 beds, is representative of about 50 beds available across the province in DHAs, and we have made the district health authorities aware of this issue, and we're waiting for their proposals to come forward on where they want the placement of those beds. There has been 40 beds committed to Northwood for a sort of an interim unit at their facility. They had a floor that had been basically gutted, and they were going to be transferring that into a number of beds, so into 40 beds. There's then 31 beds that we're working at right now in the HRM area as well through Melville Gardens. There are some issues that we're trying to work through with the city and the operator when it comes to the correct permitting and the construction of the beds that they have now. There were 6 beds made available through Peters Place, as well as a number of beds available in the Cape Breton district. And as well, there was the Bayside beds that were being transferred from the Department of Community Services to the Department of Health, and of course there'll be an expansion of that facility as well. You know, the issue, we really understand the issue that before the 832 beds or 832 beds are available across the province, that we're going to be still having to work on some mitigation strategies to make sure that our seniors and our special needs individuals receive the services that they require before these beds are open for their use.
The honourable member for Sackville-Cobequid.
And actually, it's kind of a shame, because I don't think, I know I don't, and our caucus doesn't like promoting the fact that we want to see more transitional care beds in the province, because ultimately that's not the most appropriate space for our seniors and for those who need care ought to be located or live in, Mr. Chairman, because, you know, they don't have the services like a long-term care facility would have, and so we know the need for it, but I hope it's a temporary thing. One of the things we've done is we spoke with a lot of nursing homes and the administrators and those who run them throughout the province, and I know that many of them have proposals and ideas on how to expand their secured care capacity, because that's an important issue. I know we've mentioned many times to the Minister around the increased number of Nova Scotians with Alzheimer's, with dementia, and those requiring secured care in this province. So I'm wondering if the government has any plans to provide capital funding to convert beds into secured units to mitigate the situation while they unfold their strategic framework plan with the increase of new nursing home beds down the road. So is there any capital funding available now for those nursing homes that could convert some of their rooms into secured a secured room or facility, Mr. Chairman, to the Minister?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And what we expect to see as we work through this RFP process of making it available, hopefully into next week, I believe, is what our deadline is to get the RFP available, is that through the new construction of beds, there will have to be some renovations done to the facilities that would be having expansions. And of course, we'll be having completely brand new facilities built in some communities across the province as well. And what we would expect from the data that we've been able to collect, from the information that we have, that some of those beds would be available in a special needs configuration, where you would take people with Alzheimer's and other dementia. So we basically call it a challenging behavior unit. So we would see the expansion of that happen in conjunction with the construction of new beds across the system. But I can also say to the member opposite that there has been a lot of discussions happen since we made that announcement in Truro a number of weeks ago. There has been a lot of discussion with current operators, current associations that operate some of these facilities, some of the private operators as well, on exactly what the new beds will look like, what the new construction guidelines will be, and what our expectations are going to be. And part of those expectations, of course, is making sure that we have those challenging behavior units available.
The honourable member for Sackville-Cobequid.
Thank you, Mr. Chairman. I think it's important. I hope the minister realizes the need is yesterday, and we continue to bring cases to the floor of this legislature, and outside the legislature, to the minister's attention around especially around the 100-kilometer rule, and how we feel that it's a rule that, especially with those families and loved ones who have to place a loved one into a long-term care facility with disease like Alzheimer's or dementia, that 100-kilometer rule really doesn't apply to them, because it goes to the nearest appropriate facility that can handle the situation or handle their behavior, especially Mr. Chairman. So we need to look at that now. We need to ensure that from now to the time that the government can stand up and say that we have a brand new room or a bed, long-term care bed in the province, and the construction of new facilities, that we continue to ensure that families who have a loved one who is being placed, that it's not detrimental because of the distance traveled in between, and especially around the 100-kilometer rule. So with the government's plan, or the strategic framework plan, and the number of new beds that the minister has stated, 823, I believe, over 10 years, can he tell me what portion of those new beds will be capable of handling clients with challenging behaviors or with dementia or Alzheimer's?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And it would be very difficult to really define the actual percentage of challenge behavior units that will be available to Nova Scotians once the beds are constructed. What we are trying to do, sort of in conjunction with this RFP process, that I think once that's out there and we have the proposals come back, we've sort of made it known that we do want to have more beds available for challenging behavior. But also what we're doing at the same time is that we're investing in some community development around challenge behavior, how to keep some of these individuals in their homes, in their communities longer, or in different levels of care without having to go to a full Alzheimer's unit or challenging behavior unit. And what we're seeing is that this year we've invested about an extra $75,000 to help out in home care in challenging behaviors, to a total right now of $300,000. But Mr. Chair, the 100-kilometer rule, even though it is one that we would like to change, and one that is very difficult, we understand and we know, on families, there are sometimes a lot of decisions that have to be made on patient safety, making sure they're in the correct facility, making sure that they have the correct services. Also, because of adult protection orders, we have to find beds for certain individuals, and that may bump some other people that are, of course, been waiting on those waiting lists. So I know it's sort of a program that's that's in flux, but it is one that we are striving and we know we are making better. And hopefully over the next 3 years, you'll see some dramatic changes in the way that we react and how we work with our patients who are going to long-term care facilities.
The honourable member for Sackville-Cobequid.
And that's why I bring awareness around this issue, is that, you know, it's important to recognize that, you know, I don't want to see a single facility in the province for individuals who might need a secured treatment. We need to spread it out so that families, people in the community, their friends can assist a facility, especially with someone who's fighting these diseases, because I think that's the most important thing is change for someone who has dementia or Alzheimer's is huge. It's huge, and it's detrimental to their health. There's been studies that say that those individuals who are taken out of their community, out of the areas that they have their support system in, do worse in other communities when they don't have that support of the community. It's not just the healthcare needs that we need to ensure that they have. We need to ensure that they have the support of their families, friends, and ultimately their community, Mr. Chairman. So one of the things that we have mentioned, and hopefully the government will seriously look at, is especially in our announcement of what we can try to do, or what government should try to do on the 100-kilometer rule, is to have an appeal process, because, you know, families feel they have no option. They have here they are requesting a long-term care facility, and yes, maybe they do have the challenging, the patient or their family members have challenging issues that secure a proper secured fund or treatment facility, Mr. Chairman. But, you know, they feel they have no option. They just take whatever comes to them because they know they need help for their loved one. So I hope the government looks at that, one of those issues, especially around the appeal process, to allow families, because it's usually within a short period of time that they have to make a decision on transfer, especially if they're in an emergency room or on a floor of a hospital, that, you know, they have that option to give them just a little bit more time to talk with their families and figure out if that's most appropriate. So I hope government looks at some of the recommendations that we brought forward last week. One of the things we've heard about from frontline health care workers and those health care providers is that sending a senior or someone from a long-term care facility or a home for special needs is a huge cost for primary care, is a huge cost on the system. And I think some of the quotes that we've seen, some of the numbers that reflect in Capital Health alone is in the vicinity of about $10 million that the healthcare cost incurs, because, you know, they need to send someone from a nursing home to the emergency room for treatment of some kind for primary care. So I wonder if the government tracks the amount of money, or not the amount of money, sorry, Mr. Chairman, if they track the number of individuals who are in a nursing home or a long-term care facility that require transport to a higher level of care, like an emergency room or a hospital. Do you track the number of patients, number of residents that we have that do that and need the care of a hospital or an emergency room?
The Honourable the Minister of Health.
Much, Mr. Chair, and to the member, the district health authorities do track the ER visits from long-term care facilities. So there is some numbers maybe we can help provide. But Mr. Chair, what we are trying to do in order to alleviate that issue, because there is you know, tremendous cost to the system, but it's also the inconvenience to the patients, to the residents of having to go to emergency rooms to receive services. We have been working currently with the chiefs of staffs of the district health authorities, the chiefs of staff of the hospitals, to work and try to find more coverage for long-term care facilities. And of course, we are talking about the pilot project for nurse practitioners that we're currently going through at Northwood. And I know that even in my area, there is some work ongoing with one of my nursing homes and utilizing a nurse practitioner, a geriatric nurse practitioner in that area. So that individual can actually work with the health of those patients and really keep them out of the emergency room and keep them in the homes, of course, where they are much more comfortable and enjoy being a lot more than they would in emergency rooms.
The honourable member for Sackville-Cobequid.
Thank you, Mr. Chairman. I think it's important that those stats are looked at, because I think that's an area where we if we can assist a long-term care facility when dealing with hiring and human resource aspect and the scope of practice and all that would dramatically reduce the need for further treatment in a higher level of care facility like an emergency room or a hospital. And we all know what a domino effect that has on the system when someone in a long-term care facility ends up in a hospital, where if we could avert that, it would go a long way. One of the things also is around, I'd like to talk about, is around private nursing homes in the province, and around the RFP process for nursing homes and for them gaining licensing and going through that process. Many of the small operators and nonprofit groups feel the process currently is a bit unfair, and it seems to benefit those larger groups that run nursing homes here in the province, like Shannex, GEM, and the McLeod Group. So what is your department doing to try to, I think, reassure some of the smaller ones, and to encourage, I think, the nonprofit groups to take advantage of your program over the next 10 years to provide new nursing homes and nursing home beds here in the province?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And I know at this point in our current continuing care system, within our long-term care system, that there is I believe, a good mix of private and public nursing homes where where you see, of course, local organizations in conjunction with their municipalities running and owning long-term care facilities. And what I think we've done over the last number of months is really provide a lot of expertise and a lot of help to some of these for nonprofit organizations with the help that they require to get through this RFP process, so they can bid on new facilities and expansions of their facilities. And at this point, what we also feel, and there'll be some further legislation on this, is trying to create as level a playing field for people to bid on these and being able to receive the financing help for this as well. So I believe that there's been a lot of work done, and I do have to commend my continuing care division, the folks there, on the work that they're doing in preparing the industry or the groups in being ready for this RFP process that will be here in April. And Mr. Chair, if we look at what we have as a distribution of operators in our province, we have about 1/3 of those operators are private for profit, which would include the GEMs and the McLeods and other organizations, the Shannexes. Also private non-profit, which is about 1/3 of our groups, and of course the public non-profits are 1/3. So I think there's a good mix of different types of operators in our province.
The Honourable Member for Sackville-Cobequid.
Thank you, Mr. Chairman. And what I was trying to get at, to try to make sure government recognizes is, and I hope with this question you might give us some reassurance, is that what we don't want to see in the province is some of these large for-profit health companies, especially the ones from the States, coming into this province and saying, here's the provincial government of Nova Scotia going to implement 800 new beds. If we can get 500 of those, and I think they refer to big box kind of companies that will come in and take over the system. So are you going to put in place regulations or policies or legislation to ensure that we don't see an influx of these huge healthcare companies, especially from the States, come in to the province and try to get the licensing for these new nursing home beds? Because I've read reports, Mr. Chairman, that these larger facilities actually give poorer care than the smaller local companies. So are you going to put checks and balances in place to ensure that that doesn't happen here in the province when you unfold your strategic plan, or framework plan for the creation of new nursing home beds?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And there are really three things that we're doing to ensure that we don't have a huge proliferation of beds going to one company or one of those companies coming in and really eating up the whole industry and trying to run it for us. Basically, through the licensing standards and the rules that people are going to require, does set a fair amount of expectations on those operators, no matter who those operators are. The other issue, of course, revolves around the issue that we don't want to have a facility that is too small nor one that is too big. So we would want to see a facility somewhere in the range of 34 beds upwards to 100 or so beds. So we don't want to see huge facilities. We feel that it's easier for us to keep them homier and easier for the operators to run. The other issue is that there is a provision within, I believe it is within the Act, that basically doesn't allow any one company or group to own any more than, I believe it's like 10% of the beds in the province. I'm not too sure on the exact percentage, but I can provide that number for you. So there are a number of checks and balances there to ensure that the very thing the member opposite is talking about does not happen.
We'll now recognize the Honourable Member for Queens.
Thank you, Mr. Speaker. My questions today, in the interest of time, I will try to make them brief as I'm going through my preamble beforehand. First, I want to thank you, Minister, for all of the work that your department is doing, and certainly I know that given the huge portfolio that the Department of Health has, that staff have an incredible job before them each and every year that our healthcare issues grow across the province. What I want to address first are some questions that I brought up in-house before you some time ago, and I want to refer to the conditions of Simpson Hall. So I guess in some ways I'm talking about hospital and facility infrastructure here. And of course, when I brought the issue to you in the House some time ago, some photographs were tabled showing the conditions of Simpson's Hall at that time. And we understood at the time that a previous review in 2002 showed that indeed this hall should be vacated. Unfortunately, it is now 2007 and we haven't seen that take place. Meanwhile, many consumers of mental health services are in and out of this building daily to get the services that they need, and there are a number of government employees working in this building, and so I think the government does recognize, based on the recommendations from that review in 2002, that this building is posing some serious health risks to both consumers and to staff working in that building. You did indicate at the time that your department and government was trying to find ways to either renovate that building or replace it. And when I look in the budget document here, and I'm looking at the supplementary estimates here, on page 1318, when I look under capital grants, and I'm assuming that this is where some funding for infrastructure would come from under capital grants, under hospital infrastructure, I see no increase at all to any of our hospital infrastructures. So I'm wondering if your department is considering, even though there hasn't been an increase here on this line item, and your suggestion and your answer to me earlier in the House, where you would indicate that government and your department would be looking at ways to renovate or replace. Simpsons Hall, whether indeed that is going to happen over the next short term.
The Honourable the Minister of Health.
That's right. Thank you very much, Mr. Chair. Just to the previous question from the member for Sackville-Cobequid, before I get to the Simpson Hall issue with the member for Queens, no group can own more than 20% of the beds under the Act. So there is definitely a good piece of regulation there that sort of doesn't let any one company own any more than they should in the province. So not one big operator can come and take up all the beds that are going to be available. Simpson Hall. I know we've had a couple of discussions around Simpson Hall, and I know that facility, which is under the purview of DHA 9, is in dire need of replacement, just like a couple of other facilities that are under the purview of DHA 9 as well. The challenge that we have is that in order to offer the outpatient services that are available there, we need to identify other space to use, and I know that is in discussion now with the DHA, because the DHA is the ones that would bring a plan to us for us to react on. We don't sort of mandate them to replace a building or give them the money to do something, and they have to have that as a part of their budget plan. So we're awaiting right now actually a bit of a facilities review on DHA 9 to look what their requirements are going to be, which includes Simpson Hall, the Nova Scotia Hospital site, as well, I believe, a couple other locations like the Centennial Building, which the member for Sackville-Cobequid brought up in an earlier questioning during these estimates. To talk a little bit about the budget line on the $38 million. The $38 million is our capital infrastructure fund each year. So each year we get that new $38 million for investing in hospital projects. And what I'll do is I don't know which one I could use. I got two great pieces of paper here which talk about what we are working on today. Okay, there are a number of projects that are in progress or just about to start, and that's where that $38 million is used. And I know I've gone to a lot of occasions back to my cabinet colleagues looking for some more funding in that, but again, we have to balance the priorities of capital spending with the operational pieces with the issue of funding our human resources. So if we look at our cash flows or funding that's in the Cobequid Multi-Service Center, still has about $288,000 to spend. The IWK Children's Building looks at the 2006-2007 allotment. I'm just looking at projected. Which number list should I be looking for? I should be looking at this one, 0708. All right, so 0708. So let's go down the list a little bit. So the Colchester Regional Hospital development, should we come up with a final decision on that one, would see the flowing of $18 million to that community. The Lillian Fraser Hospital, which is a primary care program, looks at a flowing during this year of 1.3. The Valley Regional, which is the 21 bed and the ER expansion of 1.575 million. Halifax Infirmary, which is the ER expansion, which is a $4.2 million expansion. St. Martha's Master Plan implementation, which is a $3.4 million program. The Province-wide Infrastructure Master Plan, which is just some regular maintenance and stuff that happens around the province, which is about $250,000. The Nova Scotia Hospital Master Plan, we are looking at, which is the phase 1 of the mental health program, which is the new community-based inpatient facilities for the Nova Scotia Hospital site, is looking at the flowing of $3 million. Cape Breton ER expansion is 2.1 or $2.18 million. Inverness Hospital Master Plan, which is about $2 million. The Nova Scotia Hospital, which is the natural gas conversion, is $145,000. The building infrastructure around all DHAs, which is the regular maintenance that will be happening at all our sites, is about $10 million of infrastructure funding. So as you can see, the $38 million, even though we find a lot of places to invest it, there's probably a lot of places that we we should invest it as well, which Simpson Hall really is one of those sites that we would really like to find an opportunity to replace it and or move the services into another location so the residents and mental health consumers can receive those kinds of services.
The honourable member for Queens.
Thank you, Mr. Chair. I stand corrected as well. I called you Mr. Speaker earlier, and it should have been Mr. Chair. Again, in the interest of time, and thank you for the answer, Minister, I do hope that the department is also looking to the future in terms of any health risks posed to both consumers and staff working at Simpson Hall, that there is that forward thinking and that there will be services in place should either a staff member or a consumer be affected by working in that environment. Environmental illnesses are on the rise with individuals who are exposed unnecessarily to asbestos, mold conditions, variances of temperatures in buildings such as Simpson's Hall. So I hope that the department is looking forward or thinking forward about those possibilities and the costs that will be incurred should those risks be found with consumers. I want to move on to adolescent mental health issues. And we recognize that there are a lot of gaps between the Department of Health and also the Department of Community Services. And there is a huge lack of services for youth in this province who are facing mental health issues. And it seems that when the question is asked, which department is responsible for mental health issues facing youth, we're told from the Department of Health that it's a Department of Community Services issue. We're told from the Department of Community Services that it's a Department of Health issue. And this creates a huge problem, not only in the eyes of consumers, but it must be very confusing for departments involved as well. And part of the new initiatives in the budget document here talks about the partnering or the working together of the various departments, Department of Community Services, Health, Education, Health Promotion and Protection, and Justice, all working together to improve services to youth, but it still doesn't answer in my mind, what department is the lead department for youth with mental health issues. And so if you could give me some specifics as to who the lead department actually is and where dollars are being spent within this new initiative. Will money primarily be spent on consultation services, or will they actually go into programs themselves? And so if you could clarify that for me, please.
The Honourable the Minister of Health.
Thank you very much, Mr. Chair, and to the member from Queens. As there's been a lot of work in regards to a provincial youth strategy over the last number of months, especially with the recommendation, the conclusion of the McAvoy trial, or the McAvoy Nunn Commission. There we go. And and ultimately, it is the responsibility of the Department of Community Services to develop that youth strategy, to be the department lead on this issue. Yet, it still falls to the Department of Health on the treatment of those individuals with mental illness. So there is a fair amount of collaboration that needs to happen, and it has been happening between our two departments. The children's mental health issues has been managed through the IWK. There has been an increase in funding for part of that program, which really provides the youth assessment, the youth ordered court assessments, which is an increase of about $461,000. We are continuing to support through our department as well $208,000 for the Mental Health Attendance Center in collaboration with Justice and And I think there's a health promotion protection. I think community services in on this one as well. So this is really turning into a great collaborative approach of basically bringing down the silos of all those people that provide mental health services and treatment to youth. Because I think what was happening in the past, and this happens in governments, and it's really one of my great frustrations. Being a government member now, is that you can see these silos still exist, and if it's not my thing, it must be your thing, and if it's not my thing, it must be your thing, and you still have this battle between silos. And I think what we've agreed upon as ministers, Minister of Justice, Minister of Community Services, Minister of HBP, is that those barriers need to go down, the silos need to disappear, and we should do the things that we're supposed to do, which are help our youth and make sure that those youth at risk are helped, of course, to the best possible level.
The honourable member for Queens.
Thank you. I want to draw your attention back to the budget here. I see that there has been an increase for mental health services of over $8 million to the district health authorities. But when we move on to mental health programs, we've actually seen a decrease of well over $3 million. And I'm wondering if this is a transfer or a download of program deliveries from the district health authorities. And when I try to crunch the numbers, it still seems to me that there has been a substantial decrease to mental health programs. Like, even though the increase to that budget item for the district health authorities has actually increased, but when I look at different ways of crunching those numbers, it looks like overall there has been a decrease in programs. So, which is a concern if that is indeed the case, because we know how important it is to make sure that we have adequate services and programs in place. There is an increase of mental health issues in individuals across this province, and certainly we have seen an increase in mental health issues for youth. Depressions and psychoses is on the rise, and so I'm hoping that this isn't about transferring or downloading those programs to the DHAs where they already have an overload to try and preserve those services. And also, another quick question in there, I'm hoping too that the department is looking towards mental health and education awareness that needs to be taking place in our schools and in our workplaces. I'm hoping that the department is moving those initiatives to the forefront. We really need to remove the stigma of mental health issues or people suffering from mental health. So if you could answer my question on the budget lines and assure me that indeed what we're not seeing is a decrease.
The Honourable the Minister of Health.
Thank you very much, and I can assure the member from Queens that I don't know, the chair is trying to take care of me here. To the member from Queens, I can assure her that there is no decrease in mental health services from the Department of Health. What I will endeavour to give her, because it does make it difficult to crunch all the numbers and find out all the budget lines, that what we'll do is we'll provide her with a breakdown to that tomorrow to really understand where that funding is going. There has been no decrease. As a matter of fact, there's been somewhat of an increase, but it has been shifted from provincial-wide programs to the district health authorities with the funding. They are the individuals that provide the service to begin with, and what we're doing, what used to happen really is through their process, they would sort of bid on the money that was available at a provincial level, and we would sort of flow it down to the system. And what we've done in this budget is make it apparent and flow that money directly to them now for their mental health services. So we will provide that funding breakdown to you tomorrow.
We now recognize the Honourable Member for Halifax Needham.
Thank you very much, Mr. Chair. Minister, I'm wondering if there's any new money in this budget for families with children with autism spectrum disorder.
The Honourable the Minister of Health.
Thank you very much, Mr. Chair, and to the member. There is no increase in program for autism spectrum disorder, but the base funding for that program is remaining at $4 million as it did last year.
The honourable member for Halifax Needham.
Thank you very much, Mr. Chair. And I think that will be a disappointment. You know, when the former Minister of Health was the Minister of Health and money was announced for children with autism, we were all of the view that it was a beginning point and that there would be a gradual increase in the supports and the services that would be provided to families with children with autism. And I think we're all very aware that not all of the families were able to get access to some of the programs that were introduced. And so, you know, that is somewhat disappointing. This is a serious problem for many families. At any rate, I want to ask the minister, is there any new money in this budget for the palliative care strategy?
The Honourable, the Minister of Health.
Thank you very much, Mr. Chair. And just to finish up on the issue of autism, you know, we have not seen extra demand for the services of autism. We feel that the program is doing very well, and we have transferred that funding to the DHAs who do offer the services in the regions. The palliative care program has seen an increase this year of the $2.27 million on top of the 832,000. Okay, 832,000 in the previous year. So we continue to make, I believe, good investments in palliative care services that are so much needed in many regions in our province.
The honourable member for Halifax Needham.
Thank you. So there's $2.2 million additional dollars in this budget. That's actually very welcome news. It's been an area that certainly members of the NDP caucus have wanted to see some expansion of for some time. Mr. Chair, it's recently been brought to my attention that there's been a jump in adult protection referrals to the adult protection services in the province under the minister's direction. A jump in the number of cases, particularly referrals from the Capital Health District. And I'm wondering if the minister can provide some information about why that might be the case and what his department would be prepared to do to address that situation. From time to time, I encounter a family who's very frustrated because they've had their loved one waiting for a long time for long-term care and trying to provide care at home, and often they're unable to do that, and perhaps they'll take their elderly relative to an emergency room and insist that you know, they be provided with some level of care. And perhaps these folks are being referred on to adult protection, I'm not sure, but I'm wondering if the minister could speak to that issue, the increase in the numbers of referrals, the number of people who are going through the adult protection system through the court process, and what, if anything, his department attributes this to, and how you plan to deal with this situation.
The Honourable, the Minister of Health.
Thank you very much, Mr. Chair, and to the member. I'm not aware at this point exactly why we would see the increase in adult protection referrals, but what I will do is I'll try to provide some more information in around that. I can only surmise right now that it would maybe have to do with the acute pressures that we have in finding long-term care facilities, because adult protection orders do take precedence on the system, because we do try to place those because of dangerous situations and those types of things. But I will endeavour to have some more information for that for the member opposite tomorrow. Also, I forgot to mention in the palliative care expansion of money, we're also hiring within the department, which is one that the Palliative Care Association of Nova Scotia has asked for, is a provincial coordinator in order to try to continue on that standard of palliative care across the province, make sure that all Nova Scotians receive a fair kind of service in palliative care. So palliative care, we finished that one. Adult protection, I will endeavour to have more information.
The honourable member for Halifax Needham.
Thank you very much, Mr. Chair. Mr. Chair, as the Labour critic for the NDP caucus, I have been approached by some of the unions that represent workers in the continuing care area with a concern that they have about their workloads and about the difficulty in getting adequate numbers of personnel in the community care or the continuing care field. And they express concern about the tuition costs to attend the community college program. They express some concerns about a rule that says that if you're out of that work for 12 months, you have to do some kind of a refresher. They've identified a number of issues that they see as barriers to increasing the supply of workers available to do continuing care and to lessen the workload. And I'm wondering what the department, I'm sure this is not news to the minister or the deputy, and I'm wondering what the department is looking at doing to address these very important concerns and what money has been allocated to increase the supply of continuing care workers and make it possible to have adequate staffing in these facilities.
The Honourable, the Minister of Health.
Thank you very much, Mr. Chair. And there's a couple of things that are going on, I think, concurrently, sort of at the same time. One is that with our work with NSCC, that we have now a continuing care assistance program, which is now fully subscribed, and we will continue to work with NSCC and the Department of Education on finding ways to increase the number of seats that we're going to have available for that type of training. At this point, we're finding we're still having some trouble in getting individuals to go into more of the home care field, getting them to go out in communities and provide personal care and those kinds of things. And we need to find maybe there's a tune-up to the training program that we might have to do and again sell the field or the profession maybe a little differently. We are providing through this year's budget $900,000 in bursaries for individuals wanting to take that continuing care course. But also at the same time, we also have to be looking at the availability of LPNs and RNs for their services within those long-term care facilities as well. So as a part of the continuing care strategy, we're very, very aware of the situation, and we'll continue to work with those partners to make sure that we have enough workers to work not only the existing beds, but of course the expanded beds as well.
The Honourable Member for Halifax Needham with just less than 2 minutes.
Thank you very much. And Mr. Chair, I won't name names, but I had written the minister some time ago about a situation in my constituency of an individual who had a tumor and was having difficulty getting a diagnosis and later on treatment. And this is a question of wait times, Mr. Chair. And I could name any number of people who have come to me concerned about the extraordinary waits they have to get important diagnostic and treatment services. And I know that the minister and Mr. Clement, the federal minister, had an announcement earlier this week with respect to benchmarks and working toward reducing wait times for radiation. But and I won't minimize that. That's an important development, I think. But, Mr. Chair, I guess I'm very concerned about the wait times for things just like ultrasounds. I had a mature woman in my constituency who's waiting. I was quite shocked to hear this, who can't get an ultrasound until sometime this fall. And when she indicated that she was prepared to go out to, I think, Sackville to have one done there, she was refused, even though she knows that the wait list isn't as long there, and she lives here in the Capital District. So I'm wondering, beyond the announcement on Monday, what exactly is the department doing? And what monies are allocated in this budget to reduce wait times for procedures like ultrasounds
Order,
to get
please.
timely treatment?
The time for the NDP caucus has expired. We now recognize the honourable member for Glace Bay for the next 5 minutes.
Thank you, Mr. Chair. I know we only have a very brief period of time left, and instead of just continuing on the line that I was and line by line questions and so on, I probably should be kind enough to offer the minister some time to wrap up for at least this portion before he moves on. But I wanted to make sure that the minister has had a chance to give us his opinion in the next 2 or 3 minutes on exactly where we stand in the province today. In particular, I asked him last night about his vision for healthcare and where he thought we were going in terms of where we'll be and where our budget will take us, and the fact that we're getting to the point where it's almost 50% of our provincial budget that healthcare is taking up right now. And I'm sure over the past couple of days, the minister may have not had that much time to think about what that vision is or where it's going, because he's been on his feet continuously for hours at a time in estimates and so on. But I know we'll continue after late debate later on, but I'm wondering if the minister has any new thoughts since I last asked him that question yesterday.
The Honourable the Minister of Health.
I want to thank the member for Glace Bay for, of course, offering loaded questions there, and maybe what I'll do is I'll get to his issue in just 1 second. But maybe what I'd like to do is maybe use a couple of minutes just to answer the question for Halifax, from the member for Halifax Needham. The ultrasound one I find a bit troubling. I'm just wondering, maybe we can chat after, is just looking at the site that they're suggesting to get that ultrasound, because the different sites, of course, have different wait times. So I'm just wondering if there might be an opportunity to maybe use the Cobequid Health Centre or another facility in order to get a more timely test. The wait time strategy that we talked about, if we look at what we need to do, there was going to be some costs that we would have to have incurred anyway as a government on the updating of the linear accelerators, the hiring of more nursing staff and technologists. That this funding will help us avoid those costs, where we can actually use that funding that's been avoided now, that we can use the funding that we've saved in the other areas of wait time avoidance, or wait time helping within those wait times. So I feel, though, almost every cent that we put into the healthcare budget is aimed at reducing wait times, therefore increasing access. So there's a lot of things going on. From the wait time committee, they came back with a wonderful set of recommendations. It's now available on the website, so you can see what the provincial strategy is going to be on bringing down wait times. And I offered the member to download that, or we can even print it out for you, and you can have a good look at that. But a lot of it includes spending a fair amount of money on new equipment, continuing our training programs with our facilities to make sure that we have the right types of professionals available to offer those tests. So there's a lot of things that really have to go along at the same time in order for a lot of these things to improve that access and help those wait times. But if we could share maybe on that ultrasound issue and even the issue around the individual with the tumor, of how that's going, I'd appreciate to hear that and see what we can do as well. On to the broader question of our member for Glace Bay that brings on the issue of vision. And I mean, we've been working on a number of visions, and if you try to pull them together, the number one vision is making sure that the patient is first. You know, it's all designed towards the patient to make sure that they're going to receive fair treatment for whatever ails them. We need to continue our investments in long-term care, which I think we have a clear strategy on what that is and where those investments are going to go into the future, and we will continue those, because on the backside of that, it will free up